Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. Hello, welcome to Office Hours. So, we're going to get started. Before we do, a special announcement. For January, I am, in addition to the twice weekly videos I do, I'm going to be posting a question a day in YouTube Shorts. So, if you didn't get your question answered this week, you all have lots of questions. So now's the time. Post the questions on a video, and I will try to get to as many as I can. But I'll be doing an extra question per weekday in YouTube Shorts for the month of January. So that's very exciting, and let's get started. As a caveat before we get started, I can't answer personal medical questions. So if your question does lean a little personal, I'm going to change it because I'm not your personal doctor, and I'm going to make it a little more broadly educationally applicable. So with that being said, let's get started. So question number one, have any of your patients complained about mouth ulcers when taking tirzepatide? No. I think this has never come up in my practice. However, not everybody is textbook, in terms of side effects. So if someone's having mouth ulcers, definitely check in with your doctor. There's many, many, many different things that can cause mouth ulcers. I have not seen tirzepatide cause them. However, it doesn't mean that some people don't get aren't the 0.111% case report for each medication. Medications have side effects, and we can't always predict exactly what side effect is going to come up. You have started tirzepatide and you've subsequently developed mouth ulcers. Please let us know, but it's not something that I have heard about at all, actually. So I would be really interested to know. Of course, again, many different things can cause it. So please, anybody having this, check in with your physician. Next question. Okay, question regarding naltrexone versus topiramate. From personal experience, topiramate can cause hair loss. Does naltrexone have this side effect? Typically, no. Naltrexone does have side effects, and I made a video all about Contrave side effects, and naltrexone is part of Contrave, so you can definitely check that out. But traditionally, no, naltrexone doesn't cause hair loss. However, weight loss can certainly provoke hair loss, especially rapid weight loss. So anybody who's had bariatric surgery, started on a GLP-1, and has lost weight on a maybe more faster trajectory than others, certainly is at slightly increased risk for what we call telogen effluvium, which is basically a hair condition where your body it's like a stress response, and the hair loss is part of that stress response, and your body's perceiving the weight loss as very stressful, and as part of that effect, people lose a moderate to dramatic amount of hair in a short amount of time. But for hair loss, I always feel like that's not something you want to wait on either, because I really feel like time is hair. So whereas with some things, I will opt to trend them over time and watch them. For hair loss, I'm going to check all the labs I need to, and then I'm going to get you to derm pretty quickly, because there are many different things that cause hair loss. And if you've had weight loss, is it likely telogen effluvium? Yes, but it's also important that we make sure that we're not missing anything as well, because there are a lot of other conditions that can cause hair loss, and we want to make sure that we're catching them. So again, I'm doing your labs, I'm sending you to derm. But definitely that more rapid weight loss can cause more dramatic hair loss, but that is usually pretty time limited as well. So it's not forever in general, it's just for a short amount of time, and then the hair should come back. But that can certainly happen with weight loss. Next question. I've been taking the phentermine and topiramate my doctor prescribed for 2 days now. I've noticed my heart rate is a bit faster and my mood is slightly improved, but both are still manageable. This is a new experience for me as I haven't had these side effects with other medications. I have controlled high blood pressure and currently take fimisartan. Is it normal considering my health history? Okay, so I'm going to change this a little because I'm not your personal doctor, but I will talk about, so phentermine is a stimulant. So it is not uncommon for people to notice that their heart rate does go up a little bit, and also it can cause your blood pressure to go up a little bit. So it's not something I'm going to prescribe for somebody who has uncontrolled high blood pressure. It's not something I'm going to prescribe for somebody who has uncontrolled heart rate, tachycardia, palpitations. No, you have to figure out what's going on first and get it under control before you would think about starting something like phentermine. But it really depends on what the heart rate is. If someone's heart rate was at 60 and it went up to 70 in my clinic, I'm not going to that's not going to bother me too much. If they were at 75, 80 and now they're at 100, 105, that's something that I have to take a closer look at because I don't necessarily want them up there forever, because these medications are, this is about the heart rate, these medications are lifelong. So I don't want somebody to have sustained elevated heart rate on these medications. So, but there are certainly other things that can cause tachycardia as well. So again, especially if you're losing weight on these medications, you might not be eating and drinking as much. If you're dehydrated, that can cause tachycardia, that can cause an elevated heart rate. So there's a lot of different circumstances surrounding that. So definitely check in with your doctor. If I had somebody like this in the clinic, I'd want to make sure they're eating and drinking a normal amount, that they didn't start anything else, they didn't start any supplements, that nothing else is going on. They're hydrated. And that, their blood pressure is well controlled. But it really depends on, for me, it depends on the gradation, the amount of how much the high blood pressure, how much the heart rate went up, because depending on where you're starting from, it may or may not be a big deal. So definitely check in with your doctor, but it's not unusual that it can go up a little bit, and it really just depends on where you're starting from, and a discussion with you and your physician in terms of, is that acceptable in terms of long-term use. And the same is true with your blood pressure. Some people can notice that their blood pressure goes up a little bit. Now, if they're starting at 100 over 60 and they go up to 110 over 70, I don't think for me, that's not a big deal. But if they're at 125 over 75 and they jump to 145 over 90, again, that's not where I want them to be long term. So it's not unusual that it can go up. You want your heart rate and your blood pressure to be controlled before you start them. And then it's really a discussion about, is this appropriate long term? If you do notice increases in that. So that was an excellent question. Thank you so much. I have a more specific question on maintenance dosing. When I hit my weight goal, I understand that I'll stay at my current dosage, but I could space out my shot further, i.e. go from 7 to 8 days and space further as long as my appetite suppression and food noise is controlled. My doctor suggests I can do that. Have you done that with your patients? I will stay on Wegovy 0.5 permanently. I haven't, but I don't have a huge, especially if there's supply issues, I don't have a huge problem with that. If I had a patient who wanted to try that and see, you know what, I've been doing so well on this dose, I don't really need a ton. Let's see what happens if I go every 10 days, every 8 days, I would be open to that discussion for sure. Or, if somebody's like, oh, my supply is going to get interrupted, I'm changing insurance. Like, those are times when I might want to extend the doses a little bit longer as well. So, these are, again, we're at such a early stage in how we're using these medications. And so a lot of this is just trying things, and it's really just it's a conversation between the patient and their doctor about if they think this is safe, what are the risks and the benefits, making the best informed decision that you can. But in terms of tinkering with things. That's pretty, for me, that would be pretty mild, and I would certainly be willing to have that discussion. So that is an excellent question. Please let us know how it goes. And if anybody else has been trying that, I'd really be interested to hear about how that's doing for your maintenance. If you've noticed a difference, if your weight has gone up, if your weight has been stable. These are all really new elements to this new world of obesity medications. So I'd be really interested to hear about it. That's going to do for today. If you have questions afterwards, please leave them on this video or another video. And like I said, I'm going to be doing a question a day in January, and I'm so excited about that. So please leave your questions, and thank you so much for watching.